Well, we are back here at Performance Medicine in Kingsport, joined again by our daytime doc, Dr. Tom Rogers, and talking today about something very important all year long, but certainly most important here in October, and that's Breast Cancer Awareness Month. And Dr. Rogers, thanks for having us out.
Thank you.
Well, I know breast cancer is one of those things, as you have a daughter, you work with women, and certainly you see a lot of these cases, and you said you're starting to see them even younger.
You know, I spoke with my cousin, who's a breast cancer surgeon in Little Rock, Arkansas, last night about this. And she's certainly seeing a lot more younger patients with aggressive forms of breast cancer, which is scary.
Absolutely. What are some of the risk factors when it comes to breast cancer?
Of course, family history, but also obesity, low vitamin D, eating a high glycemic index diet, meaning too many sugars, a long exposure to estrogen. In other words, the earlier you start your periods and the later you have when you finish them means you've had a lifetime exposure to maybe too much estrogen. When it comes to hormones, which is basically what we do here, it's very complex. There's a balance between estrogen and progesterone. And if you go back to the WHI study 15 years ago, you know, people are worried about hormones causing cancer. The bottom line on that is that it's very complex. You have to know what the ratios are. You have to know whether that's a synthetic hormone or a natural hormone, which is hugely different. So there's a lot of factors. Even as far as other risk factors, night shift workers tend to have more breast cancer. People that are stressed out tend to have a lot more breast cancer. Of course, smokers and women should not drink too much alcohol. Certainly not more than 1 drink per day, maybe 2 at the most on the weekends. But all those play an important factor in the development of breast cancer. Also, eating organic is very important.
So watching the foods you're getting and where they're coming from. And of course, we've seen so many different changes when it comes to our food sources.
Right. I mean, I think one reason we're seeing more breast cancer is because of the food we eat.
And of course, we talk about how far we're coming when it comes to treating breast cancer, and that's great news. But prevention is, of course, crucial. And you said you have some items of things people can be doing in order to try to prevent or at least reduce their risk.
Well, of course, you need to, if you're obese, you need to lose weight. If you're smoking, you need to quit smoking. If you have a low vitamin D level, you need to supplement it with simple vitamin D that make a huge difference. You need to exercise. People that don't exercise get more breast cancer. And really 2 very important points I want to make today is screening. Of course, early detection is saving lives. That's why it's getting better as far as survival. It's a lot higher now because of a lot of the efforts we have with prevention. But there's 2 things I want to point out. If you feel a change in your breast that's different, I don't care if you're 25 years old or 60, you need to do 2 things. 1, see your doctor immediately. 2, get some kind of imaging test on that breast. Example, if you're 25 years old, you feel some change, see your doctor, and then you'll probably get an ultrasound. You don't have to get a mammogram with that, a non-invasive ultrasound. It's not a compression test.
But at least it can scan and find out exactly what is going on.
Exactly right. And then get mammograms. I recommend one, a baseline at age 30. And then if there's no risk factors, you can probably wait till you're 40 unless you find something. And then after 40, I recommend them yearly. Every year.
If you got something, you want to certainly catch it early.
Exactly.
Well, very important topic. Dr. Rogers, thanks so much for having us out today.
Thank you.
For more information or to get a hold of Dr. Rogers, you can always check out the website performancemedicine.net.